My book's a great place for that. Obviously, that's why
I'm gonna definitely give you a plug. The Menopause Marine. You can buy it on Amazon. It's also probably available at your local Life Med.
You can come grab a free copy. I'd love to get a free copy at Life Med. I'm joking when I say it. There are places, there's other books out there, but I think what's important, Amanda, is to recognize that we have to educate on whatever topic. It doesn't matter what it is. If we're going to buy a car, we're going to educate ourselves on the type of vehicle. If we're looking to do home improvements, we're going to do all this stuff. As it relates to health, especially, it's very, very important for women because the medical system is just very ill-equipped to help women going through that stage of life. And the crazy thing about menopause is, there's a safe window for when women, it's safest for women to start hormone replacement therapies. Generally speaking, 60 years old or younger, less than 10 years postmenopausal. The studies, the Women's Health Initiative didn't find that's the safest time to initiate HRT. Okay. Estrogen's very good at preventing. It's not good at treating. So it's all about timing of initiation.
So for folks so I think especially my generation, we started birth control. Most of us, I'll speak for myself. I started birth control probably
in your teens.
In my mid to late teens. Was on that till I had my son. Got off of it while I had my son. I was off of it for a couple years. Started back on it, and then got off of it again. And I think it wasn't until I got off of it again until then I was like, oh. What is going on? So what symptoms should people start looking at, or maybe when would be a good time to start thinking about it?
Optimally, in my world, I would be educating women in their very early 30s. Yeah. And by educating, I'm not talking about getting way in the depth, right? My daughters are 23 and 21. I talk about ovarian dysfunction and vaginal atrophy, and they're like, what's for dinner tonight? And I'm partially joking, but I'm acclimating them to it, right? So I feel like optimally women in their early 30s, I think that's an age where women can, so if I talk to my daughters in their 20s, menopause isn't even remotely on their radar.
Not even close on your radar.
And
they're thinking about having babies instead of post-babies.
100%.
Yeah.
I feel like by the age of 30-ish, women at that point are starting to recognize, okay, this is something that is going to happen. Yeah. At that age also, they're probably seeing their mothers go through it. And I got to tell you, there's a very, very big breakdown for conversations with mothers and daughters. Most women I work with, they don't have those conversations.
I don't think my mother ever talked about, she had a hysterectomy kind of young, so her process was probably a little bit different, but never a conversation.
It doesn't come up. And hysterectomy is another topic I do want to talk about before we're done, because that's a very dangerous thing, especially for women who lose their ovaries. It's called a bilateral oophorectomy. I want to talk about that.